So what is Femtech? So today we're gonna go over, so we just did like a bit of warm up and I'm gonna go through the agenda. We'll do the introduction of myself and Rachel briefly, and I'll start talking about what is Femtech all about. And we'll move on to a fireside chat with Rachel. And then we'll have a Q&A session at the end. And we'll close off the session. It's a very short session, but I hope you guys stick around. And if you have any questions, just throw in a chat or wait to the last. So we'll have a Q&A we can answer. All right, so who we are. So I'll start myself. I am the founder of VEI. VEI is a women empowerment initiative. We are currently in the development of alternative menstrual product with women and cycle in mind, and currently attending a 10X Innovation Labs Accelerator program. What about you, Rachel? Can you do a brief introduction of yourself?
Yeah, for sure. So hi, my name is Rachel Bartholomew. I am the founder of High IV Health. We're creating an intelligent and holistic pelvic rehab device for women who are experiencing pelvic-based cancers and diseases. Lily and I actually found each other through the Femtech Collective. So if you are interested in joining, there's a Slack channel through Femtech Collective. And Lily and I just connected and we've been kind of chatting ever since. And I'm over on the East Coast in Waterloo, and then Lily's our Vancouver representative.
Yes. All right, so let's get started. So what is Femtech? So Femtech is an abbreviation for female technology and refers to electronic devices, software, or other technology relating to women's health. This is defined by Cambridge Dictionary, but Femtech is pretty new. Femtech, the word came up with, so Ida, the founder of Clue, menstrual cycle tracking app, she is the founder of the Clue app, and when she was pitching her idea to investors, she came up with this word Femtech. So it's pretty new to the market, and we have it has been like so much change within the Femtech industry. The list goes menstruation and period care products, chronic condition and hormonal disorders, pregnancy and post-pregnancy, general health care, menopause, pelvic health, mental health, breastfeeding, fertility and birth control, and sexual wellness. And the mental health is one of the newest area that we started seeing in the Femtech industry. And this is the chaos map I borrowed from Armada. But as you can see, there's so many brands out there, and there's so many like interesting products. So if you are interested in, please check it out. I will share the slide with whoever attending this event. I think I will get the email list so I can share this slide with you guys. So it's Femtech to niche. So Femtech is $50 billion industry, projected to become $50 billion industry by 2025, and growth rate of 16% worldwide. And in 2019, $25 billion sales in fertility, $63 billion sales in feminine hygiene, and $37 billion sales in sexual wellness has been achieved. And some of the highlights in the Femtech industry is Elle exited with $100 million acquired by Procter & Gamble. Elle is a organic tampon and pad producer. And Progeny, they are family benefit, like the people who are planning to have family can get the employment benefit. They raise $130 million and they reach market value of $1.3 billion. And LV is a pelvic muscle training device application. They also got Series B, $42 million as well. And Femtech is not a niche market because, as you can see, half of the population is women, and 85% of consumer purchases are made by women worldwide, and 80% of healthcare decisions and purchases are made by women. And indeed, 80% of Femtech companies are founded by women. Some of the success of female founders goes generating twice as much revenue and 30% higher return on investment, 22% of lower employment turnover has been achieved. But what needs to happen? So we need all of you to play the role because we just have too many issues to solve in this area. One of the examples is lack of access to sanitization. In India, 60% of the population does not have access to toilet. And because of that, 29 health problems are arising from a lack of public health, public toilet. And the research in Canada shows lack of access to toilet increased toxic shock syndrome from the sanitary product. And if you're a woman, or people who have a menstruation, you understand how annoying it is not to have access to toilet. But with COVID, the situation has worsened. A lot of public toilet has been closed, and this will become a severe issue in the future as well. And also, women are dying from gender health data gap and underrepresented or excluded from important clinical research. What that means is, we just like, when I started this day, I looked up a lot of data, and then we found like, we don't find many data to support our case. So let's say I'm going to pitch my idea to investor. There's no data that I can say why this is an issue. Even in Japan, we have been referencing the data from 1962, believing that menstrual cycle is 25 to 38 days throughout the whole age group. But they just found out on January 2019, private company Luna, they collected all this data from menstrual cycle tracking app. The different age group has a different menstrual cycle. So this type of things, I mean, Femtech product is helping to build up the data so we can also use this data for future innovations. And also gender minority having issue too. There aren't much research happening for gender minority. So this is the area we need to focus on as well. And how is this affecting Black women? Only 23 studies done on breast and cervical cancer on Black Canadian women, and they're the third largest minority group in Canada. Black women are 3-4 times more likely to die from pregnancy-related complications than white women, but there are not enough data to support this case as well. Like Black women doesn't know how to prevent themselves or how to seek for the best treatment due to lack of data. In addition to those issues, Femtech founder face boundaries from lack of funding, responsibility of educating consumer, and cultural taboos and stigma, meeting medical requirements and regulations such as FDA, or every country has different regulations, so expanding their business globally will be another hurdle for us as well. And lack of research and data is also becoming boundaries for us to get into, get the investment or even furthering funding phase. And I think it's not really about how many mobile apps or wearables are out in the market, but how we can use the technology to improve women's health and lifestyle. So the Femtech is a bit of a fancy word and becoming a trend, but it's really, it has been there. Women's health has been there, but it's just need to be highlighted more. So Femtech, the word Femtech might help us to go through this together. We need all of you to play the role again, and I want you to think, how can you start helping women's health and lifestyle with your expertise? So why don't we move to fireside chat with Rachel?
Yeah, sounds good. Thanks for that, Lily.
Okay, so let's get it started. So Rachel, can you tell us more about High IV and how did you start your journey? Your story is very incredible, so I want everyone to listen.
Thank you, Lily. Thank you. Yeah, so High Ivy came out of a very unfortunate situation. I was diagnosed last summer with cervical cancer. I actually have my first scan tomorrow. So I'm not quite out of the woods yet in terms of cancer free. So I will find all that out tomorrow. Interesting timing. And, you know, my diagnosis with cervical cancer, it wasn't something that was planned, obviously. It threw me for a loop, but it was also kind of at this beautiful time where, thank you, yes, fingers crossed, thank you so much. You know, it came at a time where I was transitioning from, you know, selling my first company, working in the workforce, and then wanting to know what's next. And the world kind of gave me this, I hate to say cancer is a gift, but it gave me a gift. To be able to, you know, innovate in an area that needed a lot of, you know, attention. And so I took this unfortunate event. I had my surgery. I was on bed rest. I connected with these gynecological cancer groups of about 10,000 women on Facebook. And I noticed that there was this trend of these problems that kept happening after cancer care and all the rest of it once it went through treatments. And, you know, as I started to look into the problem a little further, I realized that it wasn't just cancer. It was menopause. It was postpartum complications. It was all sorts of gynecological diseases. We're all kind of dealing with the same stuff. And it was very consistent in terms of symptoms. But when I looked at what was available for us, you know, and I had had pelvic health problems in the past, no innovation happened in that span of time of like 15 years. And I'm like, something needs to happen here. And it's so interesting, you know, the points that you brought up, the lack of research is huge. When we started to create a product, I realized, holy cow, we don't have baseline data on our, I call them the disease population, but the population dealing with complications. And more importantly, I couldn't believe the consistency of these symptoms from very different sides of the coin. Like I had went through cancer treatments. We brought on a trans woman onto our team, and she was dealing with very similar symptoms as I was. And we have two completely different healthcare stories. So I really wanted to bring something that was holistic, that looked at, you know, not just one symptom like incontinence or pain. They're often interconnected. So I wanted to see if I could solve the problems with a holistic view. And you know, we initially started, so we create a therapeutic vaginal wand that provides 3 different therapies is what we're going to market with right now: a hot and cold therapy, a autodilation therapy, and a self-lubrication therapy. But I found it was so much more important to be able to put sensors on these therapies. And what those sensors allow us to do is not only collect this data, but we are collecting it against this subjective and objective data to be able to say, hey, you're a woman who's 55, African American. We see that your data pool experiences pain 15% more than the regular population. How can we be proactive in our treatment for women and bring some method to the madness? I mean, data is something we're missing, and progress is, I learned a little bit about what progress means for insurance companies in the States, they look at progress as this pain scale from 1 to 10. And if you don't move down that pain scale, you're not making progress. So I was like, we need to bring some quantification to this industry pronto, and start to be able to actually quantify progress. And so, through that process of creating, not just the device itself, but also including these sensor and data elements, we've actually made some interesting medical breakthroughs through the process. And so we found some interesting things that have to do with women's pelvic health. And so keep posted on that in terms of us releasing some more information on that. But it's been a lot of fun. So
that's amazing. That's amazing. So you didn't really have any background in medical space, right? Was it scary for you to start a company, or like, what was the boundary for you?
Yeah, it's definitely scary. I mean, I had a company previously, we did software. So software, they say, is one of the easiest. I know it definitely isn't because I did it myself, but, and then they go, oh, fear hardware, but then even much more so that fear hardware in medical, because hardware is just as tough as then getting over the hill of medical. So in reality, I look at, doctors are one piece of it. The healthcare system is one piece, but you would be surprised how knowledgeable and amazing the patients are. A lot of them will drive, especially women. We drive our own health. We take it into our own hands. We don't take no for an answer. And a lot of the girls, we become experts in a field, and we know all the ins and outs. And a lot of the times I find them a lot more knowledgeable than our basic doctors that are treating these symptoms, right? And treating these complications. So, medical is scary. It can be a big hurdle, but it is something you can learn. And if you take it on, pull those boots up and take it on, it's something that anybody can overcome.
That's inspiring. That's very inspiring. Thank you so much. Let's move on to the next question. How is your experience being an entrepreneur of a femtech business?
Yeah, it's been really great. Femtech is something that I just learned about as I started High Ivy as well. It is fairly new. And so I've been learning about this process as well. The one thing I will say about female founder groups in general is I cannot believe how supportive we are of each other. I think that is the biggest thing. I've participated in a couple different programs between Rise Ventures, Fierce Founders in Communitech. So these are some of the stuff over in my area. I'm sure you guys have some over in Vancouver, right? But I've noticed that level of competition drastically reduces. And yes, we're still competing with each other, but like we will help each other no matter what. And it is just the greatest thing about women. I used to not believe in women-based programs and stuff that was kind of focused around women as a whole. And then I just realized it's so important because we just help each other. And it's interesting you brought up Fermata. I had connected with them. They're a femtech group over in Japan. She said something really interesting to me, and she said, there's not enough of us in the femtech space, so we have to help each other. And even though we may be in competition with each other or in similar spaces, it doesn't matter. There's not enough of us, and there's too many women who are left out to dry. And so we need to help each other. And I've noticed investors who've invested in my competitors are helping me. I am like the biggest cheerleader of some of my competitors. I watch them and they are just super, super great. So I'm a huge femtech person.
Right. Yeah, I understand, because at the end, like what we want to achieve is change the world and help more women. And it's not like your ego and you want to, become a famous person. So to me, it's same. Like, yes, of course, I want my product to be successful. But at the same time, if someone can do it, if someone has a way to do it, I want to support it. So that, yeah,
100%.
yeah. So I totally agree. Cool. Thank you so much
Yeah,
for sharing.
yeah, for sure.
So next question would be, do you think we get enough funding overall in this industry?
Well, I think we all know the question to that. I am all about a good business, female, male deserves funding. I know that we also have a huge lack of funding. Part of this is not having enough women in the VC space, but we are seeing trends going the right direction. Femtech has never been hotter right now. And we're seeing tons of trends in the right direction in this standpoint. I am going through fundraising myself, so I will let you know how it goes on my
Yes,
end.
very exciting to hear.
You know, yeah, but at the same time, I went in with the approach thinking that stigma will be there, and that stigma is slowly lifting. I always come at it from an optimistic standpoint, right? So I have connected with a lot of male VCs who take it very seriously. They have wives who are dealing with these issues. They are directly connected with these issues in some sort of way, even if they are male. And it doesn't need to be this difficult to be able to get funding. And so it's starting to get the attention it needs. It's going in the right direction. We're seeing great VC groups like Portfolio, who focus specifically on femtech, women's health, and are all female-based VCs. And we're slowly starting to get our women VCs up there as well, who really help push these types of spaces because they can directly connect with them as well and know how serious they are. So we're heading in the right direction. I'm very, very optimistic about it.
That's good to know. That's very good to know. Yeah, I'm in the accelerator program right now, and I'm myself doing the pitch as well. And it's really challenging to convince people who doesn't actually experience the same thing that I'm going through. And
Yeah.
actually a good practice to think like how they see this problem through different, eyes. So
Yeah.
very exciting time.
No, for sure. 100%. I agree.
All right. So what do you want to see more, or area you think it needs more funding? Because I know there's a conversation where, okay, menstrual product, we have enough products out there, like more organic tampon in the market. I mean, I think we still need people to come in and innovate, because we haven't made much progress anyway. So I don't want to say no, but what's your opinion?
Yeah, I mean, I understand that rhetoric. I also know that, as people come in and start to innovate, even if they do start with exploring the tampon or exploring feminine products, I know that innovation leads to other things and great things. So I wouldn't necessarily want to say, if you have that idea, go for it. It is, something will come out of it that is going to be really valuable. And even if it helps one woman out there, it's worth it. I honestly believe that. And so, for me, the fertility side too is a hot area right now. I was at this summit last week, this healthcare summit where we had a femtech panel, and all they did was talk about fertility. And I was sitting in the chat screaming, going, women are more than just being able to get pregnant and have like babies. We are more than that. And you talked about this research gap in women's, women in general. There is, yes, fertility is very hot right now. That is very true. But we are more than being able to have babies. Trust me. And, I say this because I lost my fertility through my process, and I didn't have a choice in that. And, you sit there on those panels and you're going, what about like the fact that women heart health has been largely ignored? What about, the fact that women have XYZ, more conditions and are prone to more conditions than men are? What about the fact that if there's no males who can, or no females who could step into a research study, they substitute us with skinny males? Like, that is uncalled for. We have completely different hormones. We have completely different body makeups. It is kind of scary when it comes to that research gap, and just the extensiveness of the lack of women focus. And I know that they had to pull a bunch of heart health medication off the market because it actually was more damaging to women than men. And so these are the types of things that I wish people could focus on more. What is mental health? I asked you to include mental health because this is such a huge one. We have completely different brain makeups than men do. We all have a brain, but we have different stuff flowing through it, right? And that focus for women is so different. And we look at like postpartum complications and the depression that comes with that. Like, we need more people focusing on women's health as a whole, and starting to fill those gaps. I think you hit the nail on the head in terms of LGBTQ plus. That is a huge area. I was scared of it. I'm not going to lie, because I didn't know, and we shouldn't be afraid of those unknowns. And what I did was I brought this trans woman on my team, and I'm like, teach me everything. I don't want to be scared of this. I don't want to be afraid of the unknown, and I want to know how I can help. And I think that's the first step. And then for me personally, I say, I want more women, including sensors and including some of the scary stuff like hardware and going medical device routes, because I want us to drive more research. I think with my therapeutic device, the bigger conversation for me now is, if I have this data, I want to share it. And so I want to be able to put that out and share it with anybody who can use it to just make more progress with it. And so us ladies out there, if you can include a data element with this, and be able to share it. I've partnered with Google and Livestrong. They're working on open source healthcare platforms to share data. The more we can do that, the more we can actually drive further research and understand ourselves a little bit better. And I think that for me is my ultimate goal with my company, and I hope others can do the same as well.
That's beautiful. That's really beautiful. Yeah, I feel the same. Like, because I face the same issue, not having enough data in the market. Like, when I develop a product, the data should go to public, and then we should drive the research and development. Once again, like, it's an iterative process, and we want to drive that as well. That's yeah, cool.
Yeah, and I mean, for us too, it's, as we started to do this research, we realized, like, we are vagina owners, and we still didn't know half of the things that were going on in there. And it was like, wait a second, shouldn't I know my own anatomy? Like, shouldn't I know how these things work? I am an owner of one. You wouldn't like jump in the car if you didn't know how to drive it, right? You're an owner of one. So it's so interesting how this whole like history of women and research and developing medical product and medical focus for women's health has kind of led us astray a little bit in this area. It's so, I don't blame any woman for not knowing enough, because the system has kind of failed us in that direction. So. Yeah,
I just learned that like in 1998, that's when clitoris anatomy was found. That's like
1990. That's not that long ago.
No wonder why.
No wonder why a lot of us women have been left out, like, going like so disappointed.
I know, right? Yeah,
no, for sure.
Okay, so another question. So I know you have a business in New York as well.
Yes.
So like, what led to that, or like, were there anything that you faced doing business between Canada and US?
Oh gosh. So yeah, New York was just a interesting, pathway through building my business. I ended up in New York doing a pitch and ended up opening an office there.
Mm.
I moved there at the height of the pandemic and had to jump on a plane 2 days later. So I spent a whole of 2 days in New York. But it is what it is. COVID kind of threw everybody for a loop. So, um, but that being said, the US obviously, very different healthcare system is something I wanted to learn about more. I wanted to learn the gaps. Seeing the women on my Facebook groups pass away because of their lack of appropriate healthcare for them and affordable healthcare for them was something that really shocked me. It also isn't just specific to cancer, it is specific across many groups. And so I wanted to understand a little bit more about the insurance space and how that all works. And holy cow, is it complicated? Any of the ladies in the group who are in the US and navigating that, kudos to you. I don't know how you do it. But at the end of the day, US has a larger femtech presence than in Canada. So we need more ladies. We needed more femtech, activities going on in Canada. I know we talked about this before the session, how, it's hard to find us and we're kind of scattered throughout Canada and kind of doing our own thing, but we haven't done something collectively. So, part of that was just being a part of that group, understanding what's out there, understanding the healthcare system a little bit better down there. And, the US does have a little bit of a bigger focus, but I also see huge focus in Europe. France, they make it mandatory to get pelvic floor therapy after you've had a baby. So you get 10 to 20 sessions comped by the government to be able to kind of rehab yourself back with a therapist after you've had a baby. So, we are not as progressive, Canada and US as a whole. We are not as progressive as some of our European countries. And so I'm just trying to figure out the lay of the land. And then you have a place like Japan where they don't even use tampons, right? So we have this huge spectrum culturally that needs to be navigated as much as, individual countries and their regulatory approvals and that kind of thing.
Right. Yeah, definitely. Cool.
Yeah.
Thank you so much. Is there any place people can be in touch with you or can learn more about you?
Yeah, for sure. So connect with me on LinkedIn. I love connecting with people and chatting. I love having virtual coffees. If I could send people coffees, I would. I have like a long laundry list of people I owe coffees to. So please connect on LinkedIn. We are actually starting our user testing right now. So we are ramping up all of that. So if there's anyone who's interested in going through testing, you can sign up on our website. It's HiIV.com. So HYIVY. And yeah, that is kind of the biggest ask right now. The other biggest ask is participate and get involved in Femtech and don't be scared to dive into women's health and some of the scary stuff that comes along with going medical and going hardware and going data and big tech. We need more of us and we need to help each other. So, you see a woman who, needs help, extend a hand. Let's help each other out through this process. So.
Yeah, that's beautiful. Yes, thank you so much. And then your testing is very exciting. It's like, do you have a specific group of women that you are targeting, or it doesn't have to be women, but this testing?
Yeah, very good question. I should have clarified that. So, we are looking for women who are dealing with any sort of pelvic health issues, anywhere from, painful sex to, women who have went through trans surgeries or are going through that process, and any sort of conditions. So whether it's menopause, whether it's endometriosis, we see a lot, PCOS, and then we've got our girls who've went through postpartum. It's interestingly enough, I've had challenges trying to find more women women who've went through having a baby and have had some issues with that. So I tend to get more of the diseased and cancer populations signing up than I do the postpartum ladies. So if there's anyone out there, that'd be great to fill that void.
Cool. Well, I am a PCOS person, so I can be part of it.
Amazing. I didn't even know that. Okay, perfect.
Yes.
You're registered.
Yes, even PCOS is like such an unknown field. Like there is no treatment, just people tell you to take a pill. It's very sad. And then even PMS, like so many symptoms, put it into one basket saying PMS, and then like, what is this?
I know. It's so challenging. And yeah, PCOS is a scary. I mean, a lot of this stuff is scary. Endometriosis, same thing. Not a lot of research. We don't really know what's causing it. And these ladies, some of them have to go in every 5 years and have very invasive surgeries that scrape out their insides. It is horrifying. And that's the best we got. I can't believe it. So, there's a very, very far, we still have very far to go. And a lot of this stuff doesn't have a cure. Menopause does not have a cure. Postpartum complications, we can rebound from it, but they do end up compounding on each other over time. It's, a lot of this stuff is what we live with. It's our quality of life.
Right. And it impacts everything at the end, like our freedom, our life choices, and even economic of the country. So we really need more people to participate in this area. Should we move on to Q&A?
Yeah, for sure.
Okay, so does anyone have questions to Rachel or myself? You can throw a question in a session.
Lots of good chats going on.
Yeah.
All the hormonal issues we have to go through. Yes, it's so true. We don't even realize that we have a completely different hormonal makeup than men do, right? Yeah, I can explain that. So we created a vaginal wand. It is it looks very interesting. It's not your classic therapeutic wand, I guess you could say. We found that a lot of women who are dealing with complications actually have a flat anatomy. And so we have this kind of unique hook shape wand that is flat and cylindrical, flatter kind of oval shape versus cylindrical. Partially, we found that a lot of products out there were modeled after men because, men know one thing and it's the shape of a penis. And so we've created this kind of flat vaginal wand. It is inserted for about 10 to 15 minutes, a couple times a week. And what it does is it twists and clicks on different modular therapies. So we're going to market with 3. The first being an auto dilation system. So what we do is we expand to break down tissue and stretch out muscle. And what we've actually found is we can actually measure incontinence rates with that. So we dilate at multiple sizes. We also found that women can't use the static sizes. A lot of the times it doesn't work for them. We also found we have a very high pressure pelvic floor area that we have to get past. So a lot of the dilators will actually shoot out, unfortunately, if you put them in and don't pass that high pressure zone. I know, it's funny. We did a lot of that through testing. It was interesting. We have hot and cold contrast therapy. So a lot of it's really interesting. There's not a lot of products out there that are doing both hot and cold. I think we're one of the only ones. And we found that contrast actually helps with both tissue and organ recovery after dilation sessions. And so I actually got some relief from my radiation cystitis, which was fantastic for my incontinence levels. So that's why we've brought in kind of contrasting between those two. And when you think about it, we have muscles. We would put an ice pack or a hot pack on them. So why shouldn't we do that for the pelvic floor? And then the final one is the self-lubrication module. So what we do is we give dosages of lubrication through these little pods that we put in the device, and we monitor moisture levels. So what we do is, for our menopausal ladies out there who are dealing with some sort of dryness, I am in that boat as well. We actually measure that amount to bring you up to arousal level so that it is more comfortable. We reduce injury and reduce tears and that kind of thing. And you could track all this progress on your phone. And our goal is to bring more modules. So we want to go into the pleasure space and kind of have a hybrid between therapeutic and pleasure. And we're also looking to go medical. So we found so many interesting things just from sticking our temperature sensors up there. We found that us ladies dealing with issues are actually have higher temperature rates than our ladies who aren't dealing with issues. And so we're trying to explore a little bit more about what that all means. But yeah, stay tuned. Hopefully that answers your question a little bit better. I know it's hard to imagine without seeing. I will share with you if you're interested in seeing what the device looks like. Yeah, no problem.
Wow, that's exciting. So you already have a device and it's not in public, right?
Yeah, so there's not a lot of information out there, partially because I'm waiting for those damn patents to be filed. They should be done honestly any day now. So I will be releasing a lot more information. Our website's pretty bare.
That's so exciting. Okay, once you have that, I'll be sharing on my LinkedIn and other social media platform as well. That'll be very exciting. Okay, so Annika has a question about piece of advice for young female entrepreneur looking to make the jump into starting a business. Do you have anything, Rachel?
Oh gosh, I have so many. Find a great mentor. I think that is the biggest one. Find somebody who can help you through. A woman is, super great and super helpful. So if you could find that one woman that inspires you to connect with and be kind of your role model through the ups and the downs, and and it isn't always business talk. It's founder mental health as well, and health, and being able to kind of talk through some of the crappy things that come along with starting a business, but also celebrate the good things. I think for me too, it was getting out there very early on. I was really scared with my first company in sharing information about what I was doing, what I was working on, in fear that I would be judged for not knowing everything. But I took a very different approach this time around, and I just share with everybody, and the things that come with that is completely invaluable. So get out there, get sharing, don't be scared of the unknown, and do something that you're passionate about, because that is what will really push you through the tough days. For me, it's, when I have to sit here and do my bookkeeping or something like that, I'm like, think about all the ladies who need what you're working on. Think about all the ladies who need what you're working on. Just to be able to push you through some of those bigger challenges and keep you motivated. It can be tough sometimes because there could be a lot of negatives in with the positives, but those positives make it all worth it. So yeah, I don't know if that's good advice or not.
That is a good advice. How did you find a mentor? Like, what was the journey like?
Yeah, I mean, for me, it was just about I know it's so tough with COVID. I think LinkedIn is kind of how we scour a room now to be able to find somebody. But for me, it was just getting out in the community and being a part of every single thing you possibly can. I hate to use this, but I like to hoe myself out a little bit when it comes to all the programs and things you can participate in, as you could probably see on my website. And part of that is I just love to connect, and I love to, everybody has something, a little nugget of information that you need, that you don't know. And so it's like, I want to get that nugget from you. I want to know more, and I want to give you my nuggets, right? So yeah, so for me, it's just about reaching out. You'd be surprised at how many people are just willing and able to connect and chat, especially with COVID.
Right. Yeah, I totally agree. I actually, last year, I attended Vancouver Startup Week and experienced the same thing. I keep saying it's my side project. when it was actually my passion and I wanted to actually make it to a company. And then I realized through Vancouver Startup Week, people who only have an idea haven't done any action. They were saying, "Oh, I'm building my company," and I'm like, "Yeah, I already started so many things and I haven't even talked about it. Like I own this." So start small, but put yourself out there and start talking about it. And
most definitely.
Yeah. That's good. Okay, Paulina has a question. Do you focus on specific women age group when it comes to your hardware user testers?
So we are looking for all age groups. Part of that is just, trying to be inclusive to everybody. I know that our target group kind of sits at around 45 to 55. And that's just partially because, with age comes a lot of these complications, unfortunately. So, they've probably had a couple kids, they've probably entered or have already went through menopause or started menopause, and a lot of the times, I know for me, I'm a little bit unique in that cervical cancer usually doesn't come this early. So for our older ladies, some of these more serious diseases do come with that age as well. So, my target sits around 45 to 55, but I know that endometriosis starts as early as 14, 15, 16. So I'm looking for all ladies at all ages. And honestly, even my older ladies, 65 plus, come on, we still are humans. We still have pelvic floors. We still should be able to do all the things we want to do. So I've learned a lot in the gerontology space as well in our aging population and their needs as well. So I try not to focus. Pitches make you focus on a specific age group. They force you down that target market tunnel. But I always say I am willing to help every woman I possibly can.
Yeah, it's really hard because when you're starting a startup, people will tell you to focus on niche. And that is a very difficult for me, being inclusive and I want to include everyone into this space, but you kind of have to narrow down to test the user or test this segment and validate through if what you are building is actually meeting any product market fit. And how do you balance that out?
It's a challenge. Yeah, it's a challenge. And I think, my perspective on it is, yes, I have to focus. Everyone says focus on a specific area. And even as much so as, diseases and stuff like that, they go focus on one thing. You're too distracted with others. But, in reality, where does that get us? Yes, it may look like I am, maybe distracted at times, but at the same time, it really helps understand the complications and the severity of what we're dealing with and how it isn't specific to one age, one cultural group, whatever it is. So you still have to be open enough early on to be able to navigate some of those assumptions. And we're still trying to learn more about this, right? Focusing on a specific group, a specific amount of people, age group, it just narrows us too much when we still know too little as it is. So I think that's my strategy with it is to continue trying to be inclusive across all sorts of. So we're actually staging our user testing in 5 groups of 5, and so we're trying to kind of put menopausal women mixed in with, younger women mixed in with, our trans women, and be able to kind of move them through the stages so that we can see where all of the effectiveness is happening at which levels and who sees progress quicker, who doesn't, who needs a little bit more hand holding, that kind of thing. So yeah,
that's very interesting. Yeah. So do you think it's important to have an investor or partner who understand that approach?
Yeah. I mean, it's something I'm still navigating. So, in reality, there's going to be people who get it and there's going to be people who don't. I am still in the process of raising money through investors, so I will let you know how that goes. You know, part of the challenge I was going through was navigating between medical and a consumer device. So knowing that we do want to go medical eventually, and you know, some of that narrative may be great for some and not for others, right? So it's just about finding the right fit. And like I said before, I think it has to do with finding investors who really understand the space. And honestly, my perfect investor, and I encourage everyone to look for this, is have a hit list of investors that are a perfect fit for you, that fit a profile. It's kind of like dating. It's kind of like getting into a marriage, right? You have this ideal person that you're out looking for. You may not hit all the checkmark boxes, but you know, if you can hit a lot of them, that is somebody who you would want to get in bed with for the rest of your life, right? And so for me, I have this ideal investor of someone, you know, a woman who's actually went through some of these complications herself and really understands, not from a business standpoint, how, you know, impactful this can be, but also from a personal level, how impactful it can be for her as well. So I encourage everyone to do that. And you're not going to be able to make everyone happy as it is, right? So do what you can, stick on your path. You'll get so many different pieces of advice from different people, and take them all with a grain of salt, and just learn and absorb.
Cool, awesome. Yeah, you have so many members that from like a medical space, and how were you able to, you know, create that team?
Yeah. So it was funny because, so we're working with 15 different doctors, and I try to be holistic in not only my product approach, but also my mentor approach, and advisor approach. So I have sex therapists, I have pelvic floor therapists, I have gynecologists, oncologists, gerontologists, everybody under the sun. And that process, honestly, so you guys are all going to laugh at me. When I started my radiation treatments, you have to be in the hospital every single day. It's a full-time job. And I was actually laying in the radiation machine. And as you're laying there, they are kind of setting you up for radiation. I was like, this is the perfect opportunity to pitch. Like, I'm laying here, I have two people in my face setting me up, and they can't leave my side. So I'm like, I'm going to pitch to them. And so I was actually pitching to these doctors, and that's how I got my first kind of 2 doctors on my medical advisory board. Yeah, I know. It was ridiculous. They're like, can this girl just shut up and let me do my job? So, you know, I use that opportunity to get that clinical validation. And part of it is, you know, were kind of forced against their will to listen to me, but at the same time, they provided me such great feedback. And I was able to say, you know, would you be open to joining and just, you know, talking with me more? And that led to them actually helping with, you know, product research, you know, offering clinical studies. And the doctor groups are a very small group. You know, there's lots of them out there, but they do intermingle and they know each other. And one doctor led to another. And that was the beauty of it. Was I was surprised at how open they can be with sharing how much, you know, they care about patients. They really, really do. That's why they get in the you know, job they're in. You know, some aren't as progressive as others with old school, you know, ways of thinking, but and, you know, I have one of those on my medical board as well. She was actually my oncologist. So, you know, everybody has something to share and those perspectives, right? So it's important to have those people. And yeah, opportunities are everywhere. It's you just got to take advantage of the situation. And it was a unique one for me. So I was able to take what I could from it and just use it to my advantage. I had to make something great out of a shitty situation, right?
Your mentality is like super inspiring. I am sure like everyone, people who are attending this event is like,
Yeah, but you know what? I will also say this. Not everyone is able to take advantage of those opportunities at those times. So be careful with yourself. I always say I am the queen of naps. I literally had a 4-hour nap before this talk right now. So I am not perfect. And I will rightfully say that I also deal with, yay for naps. Exactly.
For naps. Me too. I was resting.
You got to be careful with yourself too. So, I'm able to do it because I'm just a social person. Everybody has their differences, and yeah, take advantage of that.
It's good to know, like, entrepreneurs are sleeping. They get to sleep, and
yes, I have to.
People afraid to start because we imagine being too busy and having gray hair, stress.
Oh, for sure.
Yeah, but okay.
Gotta be gentle with yourself.